I've been in this field for 46 years. I've been in private practice in Denver full-time for 37 years, full-time. And in terms of objectives, one of the things I've found in doing this presentation is that I've put less and less emphasis on specific things that you should do. Like, I heard an ER doc say, you know, I should tell you to get more exercise and eat right, but she said, you know, what works for me to cope with compassion fatigue is junk TV. And she said the way she got through her residency was Jerry Springer. So I found the most memorable, the most effective thing you can do, that I can do, is tell you my own experience, and hopefully what it will do for you is help you rethink your own life priorities, because that's what it did for me. And then in turn, that can have a lot to do with vicarious trauma and the growth, the vicarious growth that you get from your patients. Stonewall happened in June of 1969. And for those of you that don't know, Stonewall was a riot that was the beginning of gay liberation in the United States. And prior to that, the police would raid all the gay bars, arrest people. It was harassment. They'd arrest people for jaywalking. They would arrest them for public indecency and haul them off in paddy wagons. A drag queen named Sylvia Rivera threw a beer bottle at a police officer and started a 3-day riot. And that was the beginning of gay liberation. And the Gay Liberation Front in Seattle started right at that point. And I started my first practicum in graduate school. And I was part of a small group that was supposed to reach a hard-to-reach population. And I worked with the Gay Liberation Front. And it then shaped my whole career, because when I started in practice, all the gay therapists weren't out. It was too early. So I would get all the gay men as clients. Then in 1984, I started getting people with AIDS. The epidemic was first recognized on the coast in New York and San Francisco, and was known as the gay plague, or the gay cancer. And by the time it hit me, my first client was in 1984. In 1985, we got the HIV test, so we could tell who had the virus. And within a few years, 60% of my clients were HIV related. So this segues into the definition of trauma. A traumatic experience is defined as one that involves a threat or reality of death, serious injury, or damage to physical integrity. All of a sudden, I was getting these young guys who, you know, had worked out in the gym and done everything right, and they're sick. And they know all these people around them that are dying. This is a collage. This is a collage done by one of my clients. One of my groups did a weekend workshop where we got together, and one morning they put together, each of them put together a collage, and then we spent the rest of the day talking about what it meant. This is somebody who, 6 months after he did this, died. Down here is Band-Aids on his eye, and that's from CMV. And he had to have shots directly in his eye to slow the CMV down. Marijuana helped them with appetite at the time, so that because they had a lot of issues with weight loss. This one I missed my mind the most. Dementia was, and end-stage AIDS was common. One of the guys I saw called it his mental days. He would get in the elevator and go to his condo, and he couldn't remember what floor his condo was on. This one says, right to die. There were a lot of hastened death instances and assisted suicide, and that became, guys wanted to choose how they died, because some of the ways that they were dying were long and painful. And of course, dealing with the prejudice at the time was much greater than it is today. So we were dealing with a lot of trauma at the time. And how many of you know what a viatical settlement is? Nobody. I wouldn't know either, except at the time it became very common. Viatical settlement is where someone buys your life insurance policy betting that you're going to die. And they in turn give you a portion of it back for you to use in your remaining years. And then they get like 60% because you've named them the beneficiary of their life insurance. That just shows you kind of what we were dealing with at the time. This is a chart of how deaths progressed over the early years of the epidemic, probably the first 15 years. And you can see that the total deaths in this country from AIDS is more than the combined deaths that we've had in Vietnam, 9/11, Iraq, Afghanistan combined, almost times 10. So we were dealing with a tsunami in the first several years. This is my own practice. And these are not all people that were my clients. They were my clients, but they also included my clinical supervisor, who was a psychiatrist, my attorney, my accountant. This is the year that Brody died, and I want to tell you a little bit about Brody. Brody was a Montana cowboy who grew up, went to graduate school, got his MBA, became CEO of a medium-sized company in Denver. And when he first came to me, he said, are we living to work or working to live? And he was trying to decide whether to go on disability or not. The problem was he didn't know how to live. His whole life had been centered around his work. The other thing, coming from a ranch in Montana, is that he had a philosophy of the lone cowboy where you keep your emotions inside and you don't talk about personal things. And so he had also never had a relationship, a romantic relationship, because his life was too compartmentalized, and he was not out. People did not know that he was gay. So I put him in a therapy group of other guys that had HIV, and he was well liked. He had a lot of interest in other people, and he had thoughtful things to say. But he said to me at one point, hell would have to freeze over before he would open up. So in the second part, I'll tell you the sequel of what happened to Brody. But in terms of compassion fatigue, one of the things that made it hard with me with Brody is that I saw him for 4 years, and we had a lot of commonalities. There were many things. I worked on ranches when I was a teenager. I was a horseshoer to get through college. So we had this bond, and the more I identified with him, the more I identified with his trauma as well. Well then, Charlie died. Charlie was a friend. He wasn't a client. Charlie was so close to our family that he spent some Christmases with us, and he went on ski vacations with us. So, in terms of compassion fatigue, I've got this interaction between personal and professional that's going on that's just adding to my own vicarious trauma. Some of you probably know about the Names Project, or the quilt. This is Rock Hudson's quilt, and they were 3x6 panels that were made, not for everyone, but for a large number. And it's a visual representation of what we were experiencing. This is a number of panels, and you can see, like, this is an individual here, and another one here, and another one here. So there's 48,000 panels that are now being preserved. And that gives you an idea of what the scope of it was. The whole thing now weighs 52 tons. So vicarious trauma is a transformation of the helper's inner experience resulting from empathic engagement with the client's traumatic material. Anyone who, I'm sure all of you were witness in, at least in television, through 9/11, and you can identify your own vicarious trauma from that. But there's a physiological reason for vicarious trauma. It's that when a client describes their traumatic experience, the same part of their brain that lights up also lights up in our brain. As some of these long-term survivors, I'm sure, will tell you, this is not a one-off event. This is something that comes and goes in our profession, and depends on a lot of things. It depends on our own personal history. For instance, if you're dealing with sexually traumatized women, and that was your own experience, you're much more vulnerable. How well you take care of yourself, we'll go into that in the second part, but when you're ragged thin, it's going to be that much harder for you to not experience compassion fatigue. The first time I gave this talk, there was a social worker there who talked to me afterwards, and then I went out to lunch with her to try to help her with her issue, which was she was fairly new to a private practice and getting it going. And her husband he had an accident on a mountain bike and broke his neck, and was then paralyzed from the neck down. So she was his primary caretaker, and She was a primary breadwinner, starting a new private practice. You can see the challenges that she was dealing with in terms of avoiding burnout. Your own personal beliefs are part of that, and one of the things that happens as you get into vicarious trauma is you question your beliefs. For instance, can you trust people? That will be challenged depending on the kind of trauma that you are exposed to. Professional support is a big one. I'll talk a little more about that. And the length, intensity, and type of exposure. When I went through disaster field training, they said it's not a matter of if you will have this happen, it's a matter of when. Because it depends on how much exposure you have. And the type of trauma that you're exposed to. This is the risk of PTSD depending on the type of trauma. And you can see that something like this would probably be AIDS compared to kidnapping, torture, and captivity. The PTSD rate would be much less than dealing with this. Can you bring up the lights a little bit? I've got to read something here. In terms of dealing with vicarious trauma, another thing that I do is a pro bono evaluation for PTSD for people that are seeking asylum. And I want to read you just one of those cases so you can see that, you know, when I'm dealing with these cases, I really need to take care of myself, even more so than dealing with life-threatening illness. Client is a male from Ethiopia who was detained by police for speaking out against restrictions on academic freedom. He was accused of opposing the government and supporting the opposition party. He was beaten with sticks, suffered partial hearing loss in his left ear, was hung with a cord by his wrist from the ceiling, made to stand up while being kicked, was dropped to the ground from the ceiling with his wrist still bound, and was told he would be killed. Well, that was the usual case that I saw for them. And so what I tried to do is titrate it out. So I didn't see too many of those cases back to back. And because I had the luxury of my own schedule, I would schedule, that was about a 3-hour interview, and I'd do that in the morning. Then I'd go walk my dog and take a break for about 2 or 3 hours. And then I would devote the rest of the day to writing the affidavit for the court. Otherwise, I would have gotten compassion fatigue for sure from those cases. So the signs of vicarious trauma. It shakes your sense of safety. And, you know, like that case, that Ethiopia case, it would be easy to go away from that and end up having nightmares about torture or similar things to that. And self-esteem and trust and control and intimacy. For instance, with the trust, I go away from those interviews and think, how can people do this to each other? And how do I know that this is somebody that is not going to be a threat to me somehow? I mean, it can very much change your worldview. and your sense of control in terms of, I think as we grow up, we have a lot of assumptions about life is predictable, and if we work hard, things will come to us, and most of it is under our control. But you hear about these cases, and it sounds chaos, and we really question, how much can I control my life? And intimacy, there's a tendency to pull back and withdraw to try to feel safe. So compassion fatigue is not only vicarious trauma, although that's a big part of it, and I think that's a part we don't acknowledge enough. And there's also burnout. And I make a distinction between those two, in that I think burnout has less to do with our patients and more to do with our overall situation at work. Here's some of the components of that: high expectations, long hours, unhappy clients. As far as unhappy clients, I had a narcissistic client who just couldn't resist insulting me every session. And I've certainly gone through periods where there was no improvement. That was certainly the case when I first started seeing the guys with AIDS, because I felt pretty helpless. Everybody was dying, even though I was seeing them for their mental health kind of reasons. Feeling unappreciated and a sense of injustice at work. The long hours, high expectations. The last mental health center I worked for, I had a caseload of 300 in a year. And it was the kind of place where we would pray for cancellations. That's no way to provide service for clients. But the burnout at that place was very high. Another factor with that place was that I learned within 2 weeks that the person that was running the program was not receptive to what the staff input was. And that was very difficult. I felt very unappreciated and stuck. I lasted a year there. I think the other part of this, though, too, is what you can do to yourself. I had a friend named Jay who was a social worker in private practice, and the two of us used to get together and have union meetings. Well, our boss was ourself, but essentially what we were doing was trying to keep each other accountable that we were taking time for ourselves and not getting too overworked because of our expectations of ourselves. The postscript for that is that Jay died of cancer in his mid-40s, and it was probably good that we did those things. So once compassion fatigue is evident, here's the symptoms: cynicism, and it may appear on the surface like people don't care, but I think it's actually that you care so much and you're trying to mitigate against that, defend against that. You feel constantly exhausted, you become less efficient, and there's a disruption of your relationships, and also substance abuse is very common. And it's because you're feeling this chronic unhappiness unhappiness with your work and your life. And in my case, there was a period of time when true confessions, when I was smoking pot every day. And it was a problem. It was abuse. But it was a way to numb myself because I was also dealing with an unhappy marriage at the time. And my professional life was not going well. Well, what happens is that your personal life and professional life are intertwined with each other. So I'm going to have you do an exercise here. And what I want you to do is pair up with somebody you don't know.